Hello all, I am Dr. Hema Vaithianathan, fertility consultant at Oasis Fertility, Chennai. So ovarian cyst, does it affect fertility? Let's understand that ovarian cyst it's a common diagnosis during our routine pelvic examination or during our routine ultrasound also we incidentally detect these ovarian cysts. So the most common question that we are asked when these ovarian cysts are detected is, does this cyst affect fertility? That is a question that we commonly get. So let's understand for this the type of ovarian cyst. So first will be functional ovarian cyst. Another group of cyst is the pathological ovarian cyst. So there are two different types of cyst. So this functional cyst is a cyst that we commonly see in women. So these functional cyst is happening because of the normal menstrual cycle that is happening in ovulating women. So this functional cyst can come before the ovulation or after the ovulation, so by which it can be called as a follicular cyst or a corpus luteum cyst. So these functional cysts, they do not affect fertility. These functional cysts, they go away on their own, and even it does not need any treatment. Unless it is bigger in size, it may need some follow-up treatment. So if this functional cyst is one common type that we see, the other types of ovarian cysts are endometriomas. So endometriomas is a type of ovarian cyst. It is because of a disease known as endometriosis. So endometriosis itself is a very progressive and inflammatory disease. So if there is endometrioma, it can affect fertility and it needs proper treatment. So endometriomas, if it is managed right, it can prevent fertility issues. So sometimes endometriomas, if it is allowed to get bigger, or it can damage the ovaries, or even as a sequelae to endometriosis disease itself, because there is fallopian tube adhesions, because there is reduction in the ovarian reserve, it can affect fertility. So the other two types of cyst that can cause problem is the common cyst known as cystadenomas or dermoid cyst. So these type of cysts also should not be ignored and it should be removed. But these type of cysts, the cystadenomas and the dermoid cyst, also is commonly seen in the women of the reproductive age group. And if these cysts, if it is not managed at the right time also, it can lead to fertility problems later. So it actually depends on how bigger the cyst is and how much ovaries has been removed along with the cyst during your surgery, and sometimes because of the post-surgery complications like adhesions, it can affect fertility. So these are the type of pathological cysts that can affect fertility. So as such, having a cyst itself should not be a problem. It depends on the type of cyst. So the other type of problem that I want to mention here is the polycystic ovary syndrome. So polycystic ovary syndrome is a common problem that we are seeing, and because it has the name polycystic, doesn't mean that there is a presence of ovarian cyst, and the presence of these cysts in the polycystic ovary syndrome women is actually not a true ovarian cyst. So presence of cyst alone should not be a cause of alarm. We need a proper diagnosis and a proper follow-up.